So I would like to include in brief about the stress x-rays because they are very useful in chronic ligament injuries and very useful for decision making. They can be done in acute setting under anesthesia. They are mainly done for decision making in case of PCL injury, MCL injury and LCL injury, and stress x-rays are real-time projection of the condition of the knee joint. This is technique how we take the PCL stress view. The the knee is flexed to 90 degree and the leg up to the level of tibial tuberosity is supported with the hard surface, and the posterior drawer is done and the x-ray is taken. This is the technique of grading the posterior sag in the PCL tear cases. We identify a point 15 centimeter distally distal to the joint line and draw a line tangential to the posterior tibial cortex. Second point is identified at the junction of Blumenstadt's lines with the posterior femoral cortex, and the perpendicular is dropped from the second point to the first line and the measurement is taken. MCL and PLC stress views are taken by doing the valgus stress and varus stress, and the medial and lateral opening of joint is measured. These are these stress X-rays are useful for post-operative evaluation to see whether the ligament reconstruction has fulfilled its purpose or not. This is interpretation of the stress X-rays. If there is 0.0 to 7 millimeter of posterior tibial translation, it corresponds to normal or partial tear, that is grade 1 posterior sag in clinical examination. If there is 8 to 11 millimeter of posterior tibial translation measured in X-ray, that corresponds to complete PCL tear, and it corresponds clinically with the grade 2 tibial sag. And if there is more than 12 mm measured posterior tibial translation, that signifies the combined ligamentous injury, that is PCL injury along with the PLC injuries. So grade 3 is always indication for surgery, and grade 2 can be either taken for surgery or managed conservatively according to the clinical evaluation. And this is interpretation of varus and valgus stress test. If there is more than 4 mm opening in varus stress test, this signifies the complete PLC tear, and if there is more than 9.8 millimeter opening in valgus stress test, that signifies the complete tear of all medial structures, and these are indications for surgical treatment in medial and lateral instabilities. The alignment X-rays becomes very indispensable in cases of chronic neglected ligamentous injuries, and these are of very much value in cases of cruciate ligament reconstruction where PLC injuries were missed, because as the time passes there will be change in mechanical axis of the knee joint of the lower limb because of progressive development of varus deformity. So alignment X-ray is always the first investigation to be done in case of chronic neglected multi-ligament injury cases.